I'm so happy to be here with you all. My name is Amaka. I am a pediatric pharmacist and I will be your host today. Thank you so much for joining this Saturday morning for this educational session. Today we are going to be joined by Dr. Folake, and we are in for a really, really great session today. Dr. Folake is a current clinical GP lead in quite a deprived area, but not only being a GP lead, she wears many hats. So she's a business founder and strategist. She's a property investment consultant and a public speaker. And she really is just like an advocate for better networking between professionals and helping build sustainable wealth through property strategies, business networking, and also luxury travel experiences. So not just in healthcare, but in all aspects of life. But today, especially, we're having a session that's going to be focused on health tourism. So Dr. Folake is going to cover all the good, all the bad, and all the ugly regarding health tourism. I know in this day and age, you see people going abroad to get certain health like certain procedures, etc. Because the NHS, although it is great, it has its constraints. The waiting list can be very long, and sometimes people don't want to wait. So this session is just to make sure you're informed and just know all about the good, the bad, and the ugly, so that you can make an informed decision. So as we start, I hope you all stay tuned in. There will be a session for questions at the end. So if you have any questions, put it in the chat on Zoom, on Facebook, on LinkedIn, anywhere that you're joining from. Just pop your question in and we'll tackle that at the end. So just stay locked in. It's going to be a good educational session. So I'm going to pass you over to Dr. Folake. Welcome.
Thank you so much for that wonderful welcome, Amaka. Really great to be here with everybody today. Good morning, everybody. Thank you for sparing some of your Saturday morning. I know we're all busy on a Saturday morning, either, taking the kids for some clubs or the other, catching up with our shopping, or just having a well-deserved rest. But you've chosen to be here today, and I hope that you find this useful. Please, it's not too late to invite anybody you think that could benefit from this to join on either on the Zoom or on YouTube. You can join with your cameras off, and that's fine. So as Amaka said, yes, I am a GP in the Nottinghamshire area, and I recently started a job in quite a deprived area of the country. And it kind of highlighted a lot of things to me in terms of where the difficulties in terms of accessing healthcare is, and actually why people would choose to go to other countries to go and get healthcare as well. I have done this presentation before, but the problem is still the same. And I think the gap is even widening as well. So I'm just going to share my slide and then we can get straight into the conversation. I hope that's projecting okay for everybody. Yep. Okay, brilliant. So, yes, as Amaka said, I have titled this The Good, the Bad, and the Ugly, because when we hear health tourism, a lot of times we're looking at it in a negative sense, but there is some positive that can come out of it as long as it's done well. So, declaration again, as Amaka said, I'm here as a GP. Obviously, it's my clinical opinion. This is not part of my NHS work. I'm an independent travel agent as well. So again, there might be a bit of, conflict of interest where some people might think that might be the case. And I have been a director as well of a medical concierge company. So those are companies that will go out and retrieve patients from one country to arrange healthcare in another country, usually in the UK, because that's where I am sure of what is happening. And also, I have no intention to undermine any country's healthcare system. So, if I come across as negative, I'm sorry, this is not intended. It's just that I appreciate healthcare, is set up for the people in that country. So I trained in Nigeria and I'm working in the UK. And yes, when people come across to the UK, people say a lot of negative things. And I think Nigeria and other countries have their benefits and what they offer their people, because healthcare is part of culture, it's part of social life, and that's what the direction is going to be. So I in no way mean to undermine anybody's healthcare system or any country's healthcare system, sorry. So now, in the UK, health tourism has become really, really big for people coming into the UK for health tourism reasons. So they're coming on under different umbrella. Some people straightforward come in for health because they have the money, and some people come in, under other auspices. So like they come in as students when they have chronic healthcare problems because they know they're going to get free healthcare under the NHS. And some people come as visitors, literally dying, and they just come and then collapse at the airport, and then they get taken to the hospital. And that was quite common over the last 10 years. And the UK has tightened its visa rules so that that is less of a problem for people coming into the country just to benefit from the healthcare reasons. And a lot of us here are, will have families abroad. And yes, it's good for our relatives to get healthcare, but we also have to be socially responsible as well, because the healthcare system is not an endless pot of money. There is finite, and more people rely on it that haven't contributed to the system, the less is going to be available for people who've also then contributed to that system. So quite rightly so, they've tightened up those routes for people coming in, to come and get healthcare in the system without wanting to pay for it. If you want to pay for it, that's great. They would welcome that. But in the same way, the wave is then changing. Like, then we were having people coming into the UK. The laws are tightening up now. In fact, when we do a referral from the NHS, one of the questions it's going to ask us is this person an overseas visitor, or is this person eligible to NHS healthcare? So yes, you can get free healthcare at the point of use, but when you then have to go on to get specialist healthcare in the hospital, you would then have to declare that you can't pay for it. So you pay a health surcharge, that's for students, and that entitles you to get into, the level of healthcare that any other resident would get. But if you're a visitor, you can only get your initial emergency healthcare or GP service, but that doesn't entitle you to getting specialist healthcare, ongoing clinic appointments, and things like that. Now, it's now reversing. People are now going abroad to get healthcare, and that's because of a lot of things. So there's, the rise of social media, the rise of, publicity and things like that. And people have realized that, a lot of countries have realized that actually there is a market gap here. Let's tap into this. So hence people from the UK are going to other countries, and we'll go into the reasons for that later in the slide. And the numbers are rising. This is the national statistics for 2019. I'm sure that, if we can think between 2018 and 2019, the number doubled. You can imagine what happened after COVID. I'm sure it's more than quadrupled by now. I mean, we all see those memes on Instagram about people going to Turkey and coming back and looking different, So yeah, so the numbers are ever rising. Again, because of all the things happening in the UK. Again, we'll go into that later. So many countries of destination. I mean, I could list probably almost all countries, but the popular ones are Turkey, India, are popular ones. There's some that we don't know about. So there's some that will go back to their own home countries. Again, just like people come here as visitors, we go as visitors. I've done it before. I went home back to Nigeria as a visitor, but when I was going, I told my mom, I need XYZ doing. Make sure you line up that appointment for me because I need to sort it out while I'm there. I don't want to take time off work for that. So we go to our own home country. So those statistics would not be part of here. So this is just an example. The list is endless, to be quite honest with you. Every day I hear new countries giving different things. I'm like, what? It is never ending. And the greatest demand at the moment will be obviously cosmetic surgery procedures. Dental procedures are also very common as well, because just the way the dental system is set up in the UK, it's not as accessible, and it can be quite expensive for people as well. You don't get it done on time, those kind of things. So people just book to go and get it done abroad. Fertility is another big one, because fertility is a tertiary service. So we've got primary care, which is GPs, we've got secondary care, which is your consultant, and then you've got the tertiary care, which are the ones that are sub-specialized. So fertility is one of those ones that is sub-specialized, and the rules are very, very strict. So if you've had this, if you've had that, it's a little bit of, it's different in different areas. So some places they'll say, well, if you had one kid, we'll give you fertility for a second child. Some places you can't have had any children. Some places, if you're a smoker, if your BMI is, that's your body mass index, you're obese over a certain weight, they wouldn't give it to you. And obviously, if you're not eligible to tertiary healthcare, they won't give it to you. So I've had people who are here on sponsorship visa or working permit, and they've only been here maybe a couple of years and they're not eligible to public funds, then they won't do the fertility treatment for them. So people just go abroad and get it sorted out. And the wait in the NHS is actually quite long as well. So, why do people go abroad to go and have healthcare? And I'm sure everybody here knows somebody that has gone abroad to go and have healthcare themselves. And maybe yourself listening, you have been abroad. So, this slide is, by the way, exhaustive. And if there's anything I haven't listed on here, please list it on, put it in the chat box because I like to update my slides for future talks. But the main thing is the time. We all know that the NHS is cracking. Unfortunately, the system is not able to meet the needs and the demands of people as it used to be before. And unfortunately, COVID was peeled the layers off that before we were just about getting through and everybody was kind of managing, but then the burden of COVID for so many reasons, more sick patients, sick healthcare workers leaving to go and do things that are more, they feel are more fulfilling for them and their family, which we can't blame them for. They're human beings as well. All these things, perfect recipe for disaster. And now the NHS is trying to cope and is trying to catch up with all the backlog that we have. So you then find that things that are considered routine are now left to the back burner. Routine in the sense of it's not life and death and it's not going to lead to anything dangerous. But on the part of the patient, that routine means that they're going to have to live with whatever pain they're in or whatever discomfort they're in for longer. So people who have the money and they have the means are like, you know what, I will go abroad. It's also the effect on other things. It's the effect of the mental health, and it's also the effect on their job as well. So their income. Say, okay, yeah, I'm going to get it free for the NHS, but I can't work and I'm on SSP because I can't work. I've been on SSP for 6 months. I cannot make my commitments. I cannot pay my bills. I can't do X, Y, Z. I can't even live a quality life with my family. So I'd rather take out that loan or that money to, or remortgage my house, whatever people choose to do, to go abroad, get this procedure done, get this treatment done, come back, and I can go back to work and pay back the money. So unfortunately, it's not becoming a choice anymore. It's now becoming a necessity for people to actually seek these other things. And I know, obviously I'm a clinical lead myself, and now I'm on the other side, the dark side, as some people will call it. And I can see that people are trying hard to mitigate this problem. The issue is there's just no money anywhere, and we have to, make this possible out of nothing. So yeah, so that time people cannot give that time anymore. They are just like, look, I'm just going to go and seek healthcare somewhere else. And the cost as well. So the cost is cheaper for people. So if for people that want to do UK, that they have money to do UK private healthcare, are going to other countries, like, well, I could go to Turkey, get this thing done, have a holiday while I'm at it. And I'm sure we've all seen those reels as well. I keep saying reels on Instagram, about this all the services that they provide. They provide you with this chauffeur cars. You could come and personalized travel. They come and pick you up from the airport. They sort out your visa for you. They lodge you in a good star hotel, 4 5 star hotel. They sort out your procedure. You can go around, go and do some sightseeing if your procedure is not that severe, and come back home, and then you've had a holiday as well as you've had your procedure done. All right. So the cost is, when they add up all those costs, it's actually cheaper than getting healthcare in the UK. So that is one of the push that people are using to go. And these countries have tapped in. They've seen that it's an income revenue for them. They're like, oh, okay, so we can develop a service. We know where the NHS or other healthcare systems, not just the NHS, they're targeting other countries as well, especially African countries. We know where the problems are. We're just going to market towards that, fulfill that gap, and provide that service for people, and then they can get more income to their own country. So it's an opportunity for them. Postcode lottery means that different healthcare system, different. So I had a patient the other day who came in and said, "Oh, I want to be referred to X." I'm like, okay, who has said you should be referred to that? Why do you think where did you hear of this? And said, well, I read it on the NHS website that when somebody has had this kind of things, they can be referred to this. And I had to break down the NHS to him. Yes, it's all well and good. The NHS website says this. But at the end of the day, different localities have their own budget and they have what services that they can support within that budget. Unfortunately, what you're asking for, this locality does not have any defined service that can meet that need. So if you tell me what your problems are, I can see how best we can meet what you want exactly. Because this service you're asking for, in particular on that name, is not provided here. So that's what I call the postcode lottery. So some um, localities have access to certain things that you might then end up coming, to another locality and they don't even have that kind of thing because they just don't have the resources. They put their resources into meeting other needs. So when you work in a deprived area, there's so many things you're putting money into. You're putting money into getting people to come in to get their injections. You're putting money to getting them to come in to get their medication review for your diabetes and hypertension and all those, really, really big things. And then you don't really have money to be putting for the extra stuff that it's nice to have, but it's not, it's not going to be a life and death situation. And that's why it's a postcode lottery. And that's why obviously when you live in more affluent areas, you probably have better healthcare system, but because they have more money as well. And that's why it's more expensive to live in those areas too. And obviously, obviously now health is now a global thing where people are consulting with other people online internationally. Yeah, there are regulations around it, but it is happening now. And thanks again to social media, all the things are now more available to people as well. You've got influencers pushing different things. Obviously, we all heard about Serena Williams when she went to go and get her Sahed Manjuro, and everybody was like, wow, and that was the big publicity for Manjaro, wasn't it? And yeah, and they'd be like, oh, if she's an athlete, she's a mom, she's black, she's been so active all her life and she's still dealing with obesity, but this has changed her life. Hello, that alone is a lot of income for the pharmaceutical companies, and they've maximized on that to the maximum. But yeah, you've got that wake of influencer mentality where somebody has done something, but not even just influencers. We've all been on this, WhatsApp groups or Facebook groups where somebody says, "Oh, I got this thing done, and it was da 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 da, and it was all done, and it was finished." And it was like, "Oh, okay, where did you get that done?" So you've got that awakening and awareness for people. Now we've got the other last year, I went for a health expo in London. So this is a Turkish company, the Tourism Health and Tourism Board, are now doing expos in the UK. We had all this, like so many stands I couldn't even go through, coming to pitch directly to the UK population. Making the best of that gap that there is. People come, some of them now even have like consultation places in the UK where they'll either employ a UK person or a Turkish person who can then has a license to practice in the UK. They do the consultation here. So you don't have to go and do the initial consultation. They do the initial consultation here. They set up everything for you. So all you need to do is get to their country, do your procedure, and that's done. I've not heard of any other country that is doing that yet, but the Turkish are really big on it. They're really, really pushing on it, pushing on it. Obviously, as I said earlier, on the side of the government, it's a revenue for them, isn't it? They can get more money either through you getting a visa, you coming to spend money on healthcare in their country, and also tourism for the country as well. So that's good income for them too. Um, but the big thing is expertise in other countries, and I'm not going to sit on my high horse here and say, oh, the UK is the best. No, the UK is not best in everything. As I said, every country has its own healthcare system. There was a time I was well aware that people were going back to Nigeria to go and have fibroid surgery because in the UK, fibroid is a black problem. Majority of people that have fibroids are black people, and really big, horrible fibroids as well. So because of that, back home. And I'm sure this is for other African countries as well. So excuse me because I used the word Nigeria. I'm sure it's the same in Ghana and all other African countries as well where they deal with this kind of problem. So if I say Nigeria, just delete that from your hearing, and I'll try not to say that too much. So they go back home to go and have their procedure back home because the doctors there, that's their bread and butter. They see this every day. They deal with fibroids every day. They've got so much expertise in it. So some things that they were telling them here that, oh no, just leave it alone and don't do that. This was about maybe 20 years ago. I used to hear that when I was in doing my medical training. Even after I finished my medical training, I knew a lot of people that would just go back to their country, go and get the fibroids so that you don't come back. Because here they wouldn't even touch it. They're like, oh no, 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 it's too bad. If you do it, then you can't have children again, or they'll just do a hysterectomy, which is taking out the actual womb. Whereas in those countries, they would take out the fibroid itself. Over the years, obviously, with more immigration, the UK has developed more into its expertise, and it's not as bad anymore. But there are other things like that that we deal with that is particular to us, where we come from, and our countries are actually better placed to actually deal with those problems, and we choose to go there now, as well. And it's also about culture as well. And then there's another slide that we're going to go deeper into why people go back to their home countries. Accessibility, as I said, with the Turkish group where they come here, they do everything. It's quicker, you know. Again, very popular with the Eastern European group as well. When they come in, they get really frustrated with the NHS when they're new to the UK, and they can't understand why they can't get something done. Because back in their countries, they just pay. I want an MRI scan. I just pay for it. It's done. I don't need anybody to tell me I don't need an MRI scan. I want an MRI scan. I'm going to pay for it, and that's done. I want this level of blood test. I pay for it, and it's done. Here you go to the GP and say, well, because you don't meet this criteria, you can't have it. Why are you having it? They feel questioned. They feel they don't have a choice. They feel questioned. They feel harassed. They feel, whatever word that we use. And I've been in that position as well before when I'm like, why are you asking me those questions? I want this, and I'm even a doctor as well. But that's all because of the way the NHS is set up. We can't just keep doing things that everybody wants. It's about what is better for the global good. So in all these other countries where you can just pay for it, they can pay for it and get it. But we can't compare the NHS to that because those are private healthcare systems. People pay to get what they want. So yeah, but you're not paying here. Oh, I pay my NI. It's not the same thing, So you can't say because I pay my NI, I'm just going to ask, for this to be done. No, there you pay through your nose. And a lot of times people just do part of the procedure because they can't afford to get the whole payment. And then they come back and say, oh, I've seen this person and they said I should have this done. This is the report. I said, I'm sorry, I can't take the opinion of somebody from another country. You go back to the start of the queue, So, but it's still more accessible generally. So, this next slide that's the diaspora medical tourism. So and I'm a diaspora, obviously. I'm a first generation immigrant, as they call it. So I'm the one that has come, and my kids, will be here, and this is all they know. But I'm a diaspora person. I'm a diaspora doctor. And I don't know at what stage people decide they're not diaspora anymore, but everybody's entitled to their own opinion. But why would I go back to Nigeria for healthcare? Why would you go back to your country? Why would you go back to another African country? Why would you go back to the Caribbean? Why would you go back to any other country for healthcare? Well, I'm just more familiar with it. I know what to do. I told you the other day I was going to visit my mom, and I said, I need X, Y, Z done. Can you book me an appointment with this person, so that I can get it done while I'm there? And that was all done within, a few days. I got all that done, and I could just continue doing my holiday as I was going. That was it. I didn't have to speak to anybody. I didn't have to do anything. And I'm sure most of us would can relate with that. The culture as well, they understood the culture. I understand the culture. You understand the culture in your country. When we come here, even for people that have been here for years, there's still that, dissonance with the culture. It's like, do they not accept us or we don't accept them? Who knows? The arguments always go on forever. The point is we're of different cultures, and your culture is what makes you up, what your understanding is and what your views to life are. So if I'm discussing with a Nigerian doctor, or a doctor from my country, even before I say what I want, they can see where I'm going, isn't it? And that's why some of us will, when we register with a GP practice as well, we want to see a particular, person because we just connect. I understand what they want. I understand what their troubles are. I understand what their difficulties are. I understand what their challenges are. And in that way, I can meet their needs better. So people's health needs are better met when they then go back to their country because they're all like, oh yeah, I understand where you're going. Do this, do this, do this. If this happens, because they know the kind of way we all know the kind of way we live, you can do that as well. And it's less, I guess, expensive as well. Yeah, the costs are compared to what you get it done here, we all know. And obviously proximity to loved ones. So if you're going through, a very difficult procedure like fertility, for example, it can be a very lonely journey to go through, especially when you're here on your own. Going back home, you've got your family, you've got your relatives to support you. I mean, even pregnancy without having fertility treatment is hard. I remember having my first child here, and I was just on my own those first few weeks. I can't eat, I can't, the nausea is terrible. There's nobody to cook for me. I still have to cook and all that. Back home, we know how it is. You're treated like an egg. People are bringing things for you. You're having all that support that it doesn't happen. So imagine if you're then having a procedure on top of it. So I use fertility because I know that's one of the ones people go back home a lot for. But there are other procedures as well, some people choose to go back home for cancer treatment as well. And unfortunately, it's not accounted for by statistics because when I went home that time, I just said I was going for a holiday. I didn't really say I was going home for healthcare. So that number did not show up on that statistic that came up on the ONS slide. And obviously, as I said, it's the bread and butter in that country, that those procedures. So it's easy to do. There's no big deal about it. So, um, before we bring down the NHS and say it's not working, I thought it was just interesting to know how the NHS works because sometimes part of the problem is we not understanding how it works, and then we can take a more informed decision on where we want to get take our healthcare. So you're more empowered. You're not going away to get this healthcare solution because you're angry and you're frustrated. You know what the problems are, you know what difficulties are, and then you can just decide, okay, fair enough, this is why I'm going to go and do what I'm going to do. So as I said earlier, the healthcare system is free at the point of view. So if you're if you've got full residency, whether you're a taxpayer or not, to be honest, but as long as you're full resident in the UK, you get free healthcare all the way. The new visa systems that then limit the amount of healthcare you can get at different points. Visitors obviously will only get emergency healthcare. So say you had somebody came into the UK, they had a heart attack, the treatment is free. If you then needed to go into have a procedure as a result of that healthcare heart attack, then at some point, if it's not life-saving, again, the specialist will be able to say, if it's not life-saving, then they will start to say, look, at this point, this is how much we can treat you. We'll have to repatriate you back to your country. However, if you want to choose to stay in the healthcare, this is the cost it's going to be for you. So you can then choose what you want to do. But at least they keep you, to the level that they keep you alive, and you'll have, you can then go back to your country to go and continue that health, whatever it is you needed. And it's funded by our taxes. The people that are working are the ones that are paying into this healthcare system. Unfortunately, people that are not working are not paying into it. But as long as you have full healthcare, as long as you have full residency, you will get the whole. You're open to the whole whatever the NHS has available. And the access is based on urgency. So I said earlier, things that are considered routine are put at the back burner when there's demand. The people that things that are more urgent then have to go through. So things like cancer care will be obviously urgency. Things that you can't do, time cannot wait. So things like pregnancy, the baby's not going to wait for you. You have to do that at a time limit. So those kind of things take precedence over things that are less urgent. Um, and as I said earlier, again, is in no means to undermine where, what you call urgent. So what I call urgent is, I've got my hand and it's hurting, I need the surgery. For me, it's urgent. But in the grand scheme of things, the professional decision of urgency is, is it going to cause anything, major? Are you going to lose your arm as a result of it? Is it going to impact your lifestyle in any way? Those kind of things are levels of urgency that would determine how quickly that you're being seen. Now, unfortunately, as we know with every system in the UK, it's not that straightforward. Yes, we've got the healthcare system. It's still not the same pot. Like, the primary care pot is different from secondary care pot is different from the tertiary care pot. So there's always that argument between different ones of who's going to do what and who's not going to do what. What can they afford to do within that pot? What can they not? What can they not accommodate? Again, it creates a bit more bureaucracy in terms of how you are then seen along your journey. Some of the things have criteria of how we then refer you to those things because outside those criteria, well, we're not funded for it. Sorry, you have to go through another route. And we use a lot of evidence-based medicine. So what it means is that, people can read online that, oh, it's been found that, ginkgo biloba can help with arthritis or something, all these things that we read online. However, if it's not evidence-based and there hasn't been any, formal research done, not even just one research, lots of research is done, it will even be considered. Now, for it to then be even adopted, it then has to be the efficacy. There's lots of research terminology that they use to assess those efficacy. If it's going to benefit majority of people and it makes financial sense for them to adopt it, then they will adopt it. If it's only going to be maybe one or two out of how many other people, I don't know the number, so I'm not going to say any number, but if just one or two people out of the millions, then they might not do it. Again, there are other reasons they will decide to do it. So say if it's cancer care, for example, what is the number of people that would benefit from this treatment? Is there any alternative that would give something similar that we don't have to go to so many words like that will be used for? There are some procedures we need, procedures to assess whether they're appropriate or not. There's some things that we have to request for funding, so they're called individual funding requests as a GP. So it's not like I can just refer you for those things. So some of them are things like so say maybe like ganglion, so that's like a ball thing that people develop on their hands, and they have to go for surgery to remove them. There's some criteria that some areas would be, yeah, you can refer them for that, that's fine, because they've got a provider that's going to be able to provide you for them. But some places you have to then request for the funding, so i.e. you have to make a case for it, and then it goes to these people, then they assess whether, yeah, okay, you've given enough evidence for this, yeah, we're happy to fund it, that's fine. Or they'll say, no, we're not happy to fund it, you need to give us more evidence and things like that. So some of them are things like there's one of them that came to my mind and it just disappeared, where people have, and yeah, when people have surgery, so when you're young and you have surgery, and you have cancer, you have chemotherapy, so they can take your sperm or your eggs and then freeze it, but there's a number of years they freeze it for. If those years elapse and you want to extend it, then you would then have to make a funding request and say, well, for these reasons, this person hasn't been able to, they've not been married, or they've not had kids and they need to extend it. Then you have to make a case and say, look, this person has their eggs freeze, but for some reason they've not been able to use it, and it expires today. Can they extend it? Those kind of things. And I mentioned the national and the regional criteria earlier. So NHS website is great, but some of the information they give, sometimes I just smile to myself that some things are just not accessible there, or if even if they're accessible, it takes forever. One of them is psychosexual health. So psychosexual health are people who have problems with intercourse and intimacy with their partners. So you can then have counseling for that to support people to do that. Now, some areas, they have got funding for it, where you can then say, oh yeah, I've got problems with my partner, we're not able to have intimacy together for psychological reasons, not physical reasons. So they get funded for it. A couple of the other areas I've worked in, it doesn't happen, so they have to go privately to go and get that sorted out. But if you go on the NHS website, it will say there that you can get referred by your GP to psychosexual counselling. And the medical legal aspect is huge for doctors and the healthcare system. We would not act in ways that we would not be supported for. So some of the things that some other countries will get away with, not because we don't know that you can do it, but we just cannot do it, because if anything goes wrong, you know how the way patients are, it's going to be our problem. Oh, then why did you refer me? Or why did you do this? Why did you do this procedure when you knew that there was X% rules? The lawyers are always there waiting to come and hound us down. So we need to protect ourselves as well. A lot of the litigation is paid out of some of the NHS budget too. So again, the NHS actually has to look out for it. So if you've done something out of the guidelines and you've made a mistake, then you say, well, that's your headache. We're not going to get involved. You sort yourself out. And this can cost millions of pounds. This has wrecked a lot of families, and we're human beings as well. Not that we wouldn't do things only because of that, but we have to be guided by that as well, and be sure that we're doing the right things. Again, these frameworks are there to make sure we're doing the right things. And if we choose to go out of it, then we're putting ourselves in trouble as well. So I think I've skipped a slide there somewhere. Yes. So this one. So some of the constraints with medical tourism that you would then find is I just said about what the UK system is like. So if you're going out of the UK to go to other countries, this is some of the problems that you will then have. So the regulations are different. So I said about, the medical legal, the reasons why some procedures are not funded and why they're not done. So the regulations are different. Some other countries, the regulation is more relaxed and it allows them to do more things, but it also means that you're going to take more risks as well. So you need to be careful when you're having those consultations, look at the fine prints properly, because there might be somewhere there that says, well, if anything happens, it's your headache. And I've seen people that have gone abroad, had cosmetic surgeries, and they don't want to hear anything out of it. In the UK, if you have anything done, so a lot of the private companies, when they do stuff and you have a complication that they cannot handle, it comes back to the NHS. So you've got that free healthcare that sorts you out after somebody else, after a complication. And it's not because it's a mistake. Complications are normal. We need to take it out of our heads that everything has to be perfect. complications are normal part of any medical procedure. Things can go wrong. That's life. It's not because somebody is not competent. It's not always because people are not competent or they've not done things the right way. Your body can just not take something the right way, and people will then have competence with the best brains in the world. Now, you then need to think about what happens after those complications happen. And that's that last point, mishaps, claims and compensations. What's going to happen after that? In the NHS, if it's done under the private healthcare, and something goes wrong and you need life support or you need something, you need intensive care, they just transfer you to the NHS and that gets done. They can be dealing with whether it was a malpractice or not later. But at least at that point, that person gets the healthcare without having to go and then ask so many questions. When you go abroad, what then happens if something goes wrong? Have you sorted out your health insurance to make sure that you're covered so that if anything goes wrong, that you can then have ITU cover, or the people that are giving it to you, that procedure to you, has that been covered in the price that they've quoted for you? So those are the kind of things you need to look about at when you're saying something is cheaper. It might be more expensive here because all the things have been factored into it. You might not need it, which is great. But what if you needed it? That could be crippling for some people. And you've seen people who have raised GoFundMe because they're ready to be stuck abroad. They can't pay anymore for healthcare. The health insurance have said they can't afford it anymore. They've used all what they're entitled to. They don't have the money to come back home. And now they're putting GoFundMe out just to get the person back to the country so that they can then get the healthcare that they need. So this is going to be the responsibility of the person going abroad to go to make sure that these things are looked at properly. A simple procedure can lead to something big. No matter how simple a procedure is, the body reacts in different ways when it's under anesthetics or when you're having surgery done. The other problem is access to records. If I refer somebody on the NHS, for example, I send all their records, and there might be something in there that you think is not relevant, but it's actually relevant to the person that's doing that procedure. So now we've all got NHS apps. If you don't have your NHS app, it is available. Make sure you sign up to it. Get your surgery. Some surgeries you need a PIN to be able to get the full access for various things. So make sure you speak to your surgery to admin team to make sure that's activated. Even if you're not going abroad, it's good to have it. But when you're going abroad, that makes life so easy because some of the reasons why people never used to do this before is, I have to make a KK appointment again to get to get my records done. But now we have our records in the palm of our hands. Make sure you show that to whoever is doing your procedure to you. They go through your health records to make sure that there's nothing that you've had in the past that's going to be a problem with the procedure you're going to do now. Ethics is a big one, and the one that comes to mind is things like surrogacy and organ transplant. That is very, very, very strict here, and some countries are more relaxed about it. So again, looking at those kind of things, am I doing the right thing? And ethics, it's a personal thing. There's legislations around it, but it's also ethical as well. Am I going to pay somebody to get a kidney, or am I going to then, know that look, they have to give it out of free will? Here in the UK, it has to be free will. If there's any suggestion of coercion in any way, then it's going to be, it's not going to be taken care of. So I've said so many issues, but there's so many other things that we should think about. So, the license, appropriate procedures, the medications as well, which is where your NHS app is going to come in. The funding for those procedures you're going to do, are you paying out of pocket, or are you going to get a loan for it? But you need to think of how you're going to make that money back as well. We're also bringing back foreign illnesses as well. So people go abroad, have a procedure, they come back with something totally different, and then we have to sort it out on the NHS, and which we might, I'm not quite sure what this is about. Good job that things like malaria and typhoid are not looked at as, life and death as much anymore. We can easily manage that through A&E now. And risk of flights after surgery. So that's something you should consider as well. So clots in the lungs and the legs, heart problems and things like that. You need to really look at that. And yeah, I think I've mentioned a lot of the other ones. Social responsibility, organ harvest. We need to be careful about that. That has been, again, very popular. People go to abroad to go and have, some surgery. They put them under anesthetics where you don't have any control about what's happening to you. And then they start taking, having a field day with your organs, taking things that they shouldn't be taking out of you. So again, make sure it's somebody that is reputable that is doing that for you. And I think this is the last slide really of how to keep safe. So one, do I really need that procedure? balance the risk with the benefit. If they've said no on the NHS, understand why they've said no. It's not because we're trying to deny you, it's because maybe there's a reason why we've said no. So try and understand it. Speak to somebody in your community that understands you better and your culture. I have friends who call me and say, my GP said this, da, 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 da. And I said, you know what? I actually see the point of your GP. And then by the time we have the conversation, oh, that really makes sense after all, because I said it because they trust me and we have the same culture. So speak to somebody, and just understand where they're coming from, and then you can take those decisions. Um, continuity of care package. So you've gone to do a procedure. When you come back, how is your care going to be continued for? Again, as I said, with the budget, primary care has a budget, secondary care has a budget. In the NHS, if you have a surgery to some number of days, it is still the secondary care that takes care of your needs. If you then come back to me and say, oh, Dr. Yusuff, I've had this thing done. This is my discharge letter. They say you should do X, Y, Z. I don't know anything about that. I don't even know what to do. I have to refer you back into the NHS. That would take some days. Meanwhile, your letter said, oh, this should be done in 2 days. Well, I can't even do that in 2 days. My letter is not going to get ready in 2 days. What then happens to you? So make sure all those things are looked after. Make sure your continuity of care package is reasonable. Even to get a GP appointment now, we all know 2 days you won't get an appointment. So make sure it's a reasonable package of aftercare that they've given you. If you need to stay longer to get it done, I would say stay longer to get it done, or else it's just going to mess up your procedure. I've said about insurance if it goes wrong. What happens if the surgery is not straightforward? Make sure your insurance is also covered for that. Travel vaccines, obviously, if you're going abroad, make sure your vaccines are done. Languages, make sure you understand what they're telling you. Go with somebody, if you can, to be there as your chaperone. So if anything goes wrong, they're there looking out for you as well. And that's me. So thank you so much for listening to me. But this is my last slide. If in doubt at any point, do not hesitate to say no. Thank you so much.
Thank you so much, Dr. Folake. That was such a knowledgeable and insightful session. I think it's really helpful having someone like yourself, like on the other side, like as that you work for the NHS, but also like you have experience with people, maybe people that you know, people that you see going abroad. So it's good to hear like the balance of the arguments for and the arguments against, because I know a lot of people might be just like, no, it's so unsafe. It's you shouldn't be doing that. But then another argument is that oh, I don't want to be waiting for ages, blah blah blah. So there's the goods and the bad and the ugly, like you said exactly. So it's just good to be informed. So I hope you all enjoyed that session and you learned something from it. And we're just going to go through some questions. You've got quite a few questions, Dr. Folake. So we'll start with just the first ones from some of the social accounts that people have been joining from. Somebody has asked, you might have covered this a bit, but if I go abroad for a treatment and have complications on return, who is responsible for their aftercare?
Yeah, so as I said, that is something that you do need to discuss with them when you come. Obviously, when you come to NHS and you're entitled to healthcare, we have no choice. We have to look after you somehow. Is how timely that is then going to happen and what the complication is like. So if you have like a something that is urgent, to say you're bleeding, for example, that's the common thing that I would say, well, you need to just go straight to A&E. Don't bother even coming to the GP surgery because there's nothing I can do about it. Depends on what the complication is. If it's urgent, go straight to A&E. If it's not urgent, then you speak to your GP and then they'll then refer you to the relevant body. Now, the body is not perfect. There's some things that we can correct, and then unfortunately, there's some things that you're going to have to live with, depending on what that complication is like. Some things they cannot reverse. So it's one of those that you would then have to understand what the complication is, and then they will then advise you what the best way forward is. So again, you've come back to UK, we can't say you have to go back to where you're coming from, because if you go back, then you have to pay more money to get it done. If you've got the money to go back for it, why, yeah, it's best for the person who did the procedure to attend to the complications. So if it's in the NHS, whoever did the procedure is responsible for it. But this is outside the NHS now. What do? We have to sort it out somehow. So you have to then go back to your GP. They'll have to refer you to whatever specialty. If they can help you, they would help you. And if they can, then they will let you know what the options are thereafter.
Okay, thank you so much. The next question, it's quite an interesting one, which I also think about. Doesn't health tourism take away resources from local systems in those countries that people are traveling to get the procedures?
Well, a lot of the countries that do this need the money. So if you look at some of the countries that we've listed, no matter how bad we're having it in the UK, we are still one of the ones that are the richer countries in the world. We have more disposable income. We're the ones that go on travel. We're the ones that go to other countries to spend on them. So their priorities are totally different. We think, oh, they're taking from the resources. Well, the people that don't have the money anyway, and they would rather have this money to develop their country as well. So there's no perfect answer. There's never going to be a perfect, situation here. It depends on what they need. These countries, they need to survive. They need these people to come in, to pay that money so that they can use the money to do other things as well. We're lucky to have the NHS here where it's free for us. Those people have to pay for their healthcare. If they're not earning enough, they can't pay for the healthcare system. So there is the room for it, basically, and that's why they're offering it.
Yeah, absolutely. Yeah, because it is interesting because it's like the money that people who are paying from abroad to have these procedures, the countries they're getting the money so they can use that money to invest into their own systems.
Exactly,
Yeah.
exactly. And they get better, they get the expertise,
Yeah.
and then they can get more people come as
And they
well.
get more people, yeah, so it's like a cycle. We've just got a comment from Anne from YouTube who said that she would definitely um go abroad for treatment if she could afford it because like some medical books have not been updated with the treatment options for black and brown people. She went on to say that her friend almost died after being given blood pressure medications unsuitable for black people, and it was an African doctor who noticed and picked up on this and told them to stop them immediately, and she recovered after. So like what you were saying about the fibroids, how it's seen in this country as a condition predominantly affecting black women, but when you go back home and see patients dealing with it, and doctors know are very, very experienced, so they know exactly how to advise and what to do. So it's just interesting seeing people's different opinions and people's different experiences. We've got another comment from Anne on YouTube as well, who said that some other clinics abroad go the extra mile and make the effort to ensure clients' languages are honoured, like appointment messaging systems. They need to be updated in the NHS to embrace this because I work in the NHS myself, and there is a big, big language barrier because of how multicultural our country is. You have people from Pakistan, Nigeria, India, and you have all these different languages, but it can take quite some time to find a suitable interpreter, and that can sometimes delay treatment, etc. But if you go abroad, some of these countries really make sure those basic needs are met. So yeah, it's just interesting seeing.
I will comment on that, and any of my friends that we have a conversation or relatives or have a conversation about healthcare in the UK compared to abroad, and there's always this argument about, oh, the healthcare abroad is better, da, da, da. And I said, look, you're not comparing like for like. You're
Yeah.
comparing a free healthcare system or relatively free healthcare system to a fully private healthcare system. Don't forget, this people is customer service for them, right? The more they can do, and you're going to pay for it anyway, so they're going to invest in the system. The government, yeah, they can increase our taxes, but the taxes are not only going to the healthcare system, it's going to all the other things. And I'm not excusing the fact that the government could do more. I totally get it. But we have to be careful how we compare things. This is, it's just like me going into one of the private hospitals in the UK and say, oh, it's all posh and, it's all, the receptionist smiles at you and they'll offer you a cup of tea and water when you come in. I don't even know why I'm going to the NHS and people are not, they don't give me that. It's different. Like, they're working, they are paying, you're paying for all that. You're not paying for it. So we need to be careful. We've got the NHS, and I think because I trained in Nigeria, I keep saying this, the NHS is amazing, guys. Like you need to actually live in countries where you don't have healthcare. I've seen people in Nigeria die in A&E because they cannot pay for oxygen. So we need to be careful not to bring down something. We can make it better. And yes, I get it. We need to reach people where we need to reach them. But as patients as well, we need to start taking some responsibility as well to keep the NHS going. Because if it goes, because it's not perfect, and we're comparing it to this healthcare systems where people pay for it, we're the ones that are going to suffer at the end of the day. So we need to be careful how we kind of compare it. I get it, we can get better, and they're always trying to get better, but they are getting better. The focus is mainly on the core services. The extra things we can always sort out. Nowadays, there's always interpreters. You can use online interpreters for things. We encourage people to bring in relatives with them if they can. There are ways that people are using to mitigate this difference. But again, especially like with my Eastern European patients, I always tell them that, yeah, but you paid for this. Why you like you can't come and complain that, oh, I went to this country and within 1 week I got this paid for. Yeah, if you want to pay 500, £1,000, be my guest. You'll get your MRI scan done tomorrow with a private provider. So, it's a balance. It's a balance. And I know people are suffering. I'm not taking that away from them, but we also have to appreciate that, it's a general good this time. This is not what my pocket can do for me.
Yeah, no, absolutely. I'm very glad you mentioned that as well because I think oftentimes we can compare and we can and we can forget that we are not paying a
Mm,
single penny for any of these treatments. And
yeah.
yeah, I think that's important.
When
And
Americans come here, they
yeah,
can't believe it. Sometimes they even offer payment that, look, guys, I can't pay. Like, no, 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 so let's not bring it down too much. Let's
yeah,
encourage, not bring down the system.
yeah, and yeah, recognize our privilege. Like, yeah, we are very privileged. It can be better, and we want it to be better. Okay, let's get into some other questions. Joyce has asked, if you know of a website that we can put in a condition and tells you which countries are best for it. And I haven't heard about that.
No,
No,
I haven't heard, I don't know of anyone. I think it usually ends up being local knowledge or people who,
knowledge.
yeah, people who recommendations as well, people who've been somewhere before that would say, oh yeah, been here and they're good at this kind of thing. But yeah, no, there's nothing like that I'm aware of. If anybody knows, feel free to let me know. That would be really helpful too.
We've got another question by Joyce as well about can you get NHS aftercare in the UK after having a private procedure in the UK?
Again, depends on the level of aftercare. So, immediate aftercare should be provided by the surgeon.
Yeah.
If it's going to be transferred to the NHS, I'm not going to shoot myself in the foot here. It depends on the GP surgery. So
Okay.
some surgeries, because of funding in the area, have decided, like my surgery, we don't do it. I was like, well, you've paid for it. There you go. Let them finish everything that has to do with that. Yes, some people will argue that, yeah, but I've saved money by going to go and do it myself. I get it. But you coming back to meet me means I don't have the funding for it. That funding is with the secondary care. It's not from the GP practice. So if I do it for you, I'm denying John and Anne their blood pressure appointments, their diabetes care, because that fund, that time has to come from somewhere else. So
Yeah.
my surgery would not do it,
Yeah.
and they say, well, that don't transfer it to me. You've had your whatever care it is, and they said you have blood tests done every so often. They sort it out, or you go and get somebody private to do your blood test for you. We're not going to get involved in that. Some other surgeries, well, my surgery as well do that. Sorry, apologies. If you've had that surgery, so say if you normally would have that surgery on the NHS and that package would be transferred at some point, because that means that funding, that money is available to us, then we'll take care of it. So again, going back to bariatric surgery, so they usually will say they should have B12 injections for lifelong, for example, which would be ridiculous for say, oh, keep going back to the private hospital to do it. If you had it done on the NHS, that will be transferred to the GP to do it, then we'll be able to do it. So that kind of thing we will take on. So again, it depends on the GP surgery. Some will like anything you bring to them, they will happily take it. And some surgeries will be strict and say only things that we would normally do with the if it was on the NHS, then we'll do. So again, it just depends on what this procedure you're talking about is. Immediate care is always secondary care, and it should be in the UK. Ideally, should be with the person that you've done it because there should be regulations around it. And then ongoing, like chronic care, you just have to have the discussion with your surgery and see if it's something that they'll be able to fulfill for you.
Okay, thank you so much for that, Dr. Folake. And just to end on a comment by Basola on the chat, I know we say the NHS is free, but it's free for us at the point of care, but the money comes from somewhere, so it's not completely free. We pay for it via our taxes, but a balance of managed expectation is equally important. So thank you all for joining so much for this session. I hope you learned something today. Share it with your friends. If you came late, it's going to be uploaded up on YouTube. Share it with your network because these sessions are really important just to educate us and just increase our knowledge of things that we might not know much about. So a massive thank you again, Dr. Folake. I'm going to hand it over to Mariam as well, who is part of the Khan team. Thank you so much for Khan for providing these sessions. I think it's really important in our communities that we have access to sessions like this. So I'm going to pass it on to Mariam, and I hope you all have a wonderful, wonderful Saturday.
Thank you. Thank you so much, Dr. Falake and Amaka again for such an insightful, honest and grounded discussion. I mean, you've helped us clearly understand not just the way medical tourism work, but also the risk and the realities. And I think one key message for me is the importance of informed choices that we make about our health. So thank you so much again. And I'm sure we all took something great out of this session. So I'm going to be closing the session, but just before we go, I'm going to share my slide and then just walk us through what we have coming at Scan. Just a minute. Okay, please let me know if you can see my slides.
Yes, we can.
Yes, perfect. Thank you so much. Thanks everyone for staying up to this time. So we're going to be back again next week for another informative session. So we're going to be talking about vaccinations. I know it's a big thing in our community. We're going to be breaking down some myths that we have about vaccines and also inform us, what kind of vaccines there is for different stages of life. So we're going to be back here next week, same time, 11 to 12. Please scan the QR code to register, and also you can join our WhatsApp groups as well to get reminders to join the session. Okay, so this year, later in the year, we're going to be celebrating our Black healthcare professionals like we always do every year. We want to, celebrate them for their excellence and the impact they've made in our community, especially in healthcare. So please feel free to nominate. We're going to be the link is on here. You can scan the QR code and nominate. If you are someone that have made, great impact in our community, please feel free to nominate yourself and also share with your community as well. And anyone you know that has made impact, we want to celebrate them. We want to, give them awards and really, shout out about the change they're making in our community. So the deadline is 29th of next month. So please feel free to nominate as many. Also, we have our culturally tailored counseling for Caribbean and Africans in the UK. We have the services. We have our trained Black counselors who have diverse backgrounds, and who has, of course, deep understanding of our culture, and they can relate to the examples that you give them. Yeah, so feel free to call in or, refer yourself. You can scan our code on the screen, or you can send an email to counseling@can.org.uk. So following on to that, I mean, we have different services that really support our community and advocate for us as well. So we have the domestic violence and sexual abuse service, and also, how we listen to those who have experienced this, and we also help them, support them with counseling services, and also, a way to come out of the abuse. We also have our advocacy service that cover a number of things. So if you think of family, support, child support, you're unhappy with, how you're treated and all of that. We have an advocate service that can, that can hear you out and ensure that, your whatever concerns you have are taken seriously and your rights are fully respected as well. We also have our home office session where we have people from the immigration coming to answer questions that our community members have about immigration issues. We have family and advocacy service again, and then we have our legal drop-in. So please feel free to call our helpline and also send us an email if you have any concerns or anything you want us to support you with at advocacy@can.org.uk. So starting the year, we have a celebratory event coming up. We also, but before then, we have what's called Winter Gift Drive. Um, it's going to, it's a forum where families come together, we're celebrating them, but we're also providing that little extra support to families that need it. So if you have any gifts you want to give away, if you have clothes, if you have school items, giving back to family, and if you have food and other things that you think families would, benefit from during the season, please feel free to, donate. We welcome all kinds of donation. There's nothing so small or big. We just want to create that moment of joy for families. So please, you can reach out to my colleague Scholar at scholastic@can.org.uk, or you could walk in into our office at CCRC Longside to drop in any donations that you have, um, ahead of the event. So this is the event I'm referring to, the Family Joy and Wellbeing Celebration. We're starting the new year by, celebrating families who have stood together, stood strong and the previous year, and the rising pressures of life and all of that, but they've stood strong. So there's going to be fun activities. There's going to be support for those that need it. There's going to be food. There's going to be health screening as well. We talked about taking charge of your health. Yeah, so there's going to be a lot of that. We're going to meet health professionals as well. You can also have a session, ask questions and all of that. So this is going to be on the 29th of January, this month from 4:30 to 7 at our office in Longside. So please contact Scholar again at scholastica@can.org.uk for more details, or if you want to maybe register or make reservation, please feel free to reach out to us. And that is it for today. So thank you so much for joining us today. And I hope to see everyone next week for more informative sessions.